Hello and happy Sunday. This week we are talking all about pacifiers as well as ectopic pregnancies for our weekly sit-down Sunday Q&A where we answer your questions.
Yep, and just in case this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician and dad.
I'm Sarah. I'm a board-certified OBGYN and mama, and we are the Doctors Bjorkman.
So starting out this week, a question from Kimberly Terry. She says, "Hi, I'm wondering if you think pacifiers are a sleep crutch that would prevent sleep teaching from being successful. My 6-month-old loves her pacifier and she needs it to fall asleep. She cries if I lay her down to sleep without it." Yeah. So your journey is definitely not the one that is is a shared journey among many parents.
Babies love pacifiers.
We had a little one who used her pacifier to fall asleep. Didn't really love it any other time, but like there were many times where they're rocking her to sleep with the pacifier in her mouth, and then just as she was about to fall asleep in her crib, we're twisting that little pacifier out of her mouth.
Reach over the crib and just be like, "Can I sneak it out of her mouth?" Because if she fell out of her mouth and she woke up and didn't have it, problem.
Yep, and so the question is, you're trying to help your baby learn how to sleep and sustain sleep with this sleep learning process that we actually did a whole episode about. Yep. But you're finding that if the pacifier isn't in the mouth to begin with, or maybe it falls out during sleep, that they wake up. Right. And so the time when this can become a potential crutch for them is if it means that you're coming back into the room to replace the pacifier, because then they anytime the pacifier comes out, they're rewarded by seeing mom or dad, parent coming in to help them. So a couple ways around this. So one, what we did is we actually, when we said, hey, we're gonna do sleep learning, we just kind of went cold turkey on the pacifier. Yes. Our little girl didn't love it that much anyway. And so that was just something that we just worked through. Yep. The other piece though is you could teach them to put the pacifier back in their mouth on their own. This can be a fun game during the daytime. By the time they're 6 months old, they should be able to reach out and grab those and put it in their mouth on their own. And if that's not a skill they have you can work on that, praise them as they do it. And then the question is how are they going to find one little pacifier in their crib in the middle of the night? Sometimes this can be helped by just sprinkling 5, 7, 10 extra pacifiers in the crib, so that when their pacifier falls out, they just reach out their cute little hands and grab whatever pacifier is closest, because they've learned during the day they can put it back in their mouth on their own.
So there's that self-soothing that you are trying to help them learn. So that is kind of a workaround if you're not quite ready to pull the pacifier completely, that is a way around it, helping your baby learn that.
Yeah, and they're learning to be autonomous too. The one kind of piece of interesting medical information with this too is the risk of sudden infant death syndrome, or sudden unexplained infant death, is actually lower in children who use pacifiers. Yeah. There's not really great understanding why this is. Thought that maybe it helps them kind of protect the front of their face a little bit from having something cover their mouth, or it helps them coordinate their breathing throughout sleep maybe also too. So if you're a pacifier user, you definitely don't have to feel bad or guilty that your child uses a pacifier. In those first couple of months of life, it actually is associated with lower risk of sudden infant death.
Yeah. All right, good luck. Our next question comes from Annette. She says, I had an ectopic in February that ended in surgery and removal of my right tube. After 4 months, had an HSG performed on my left tube that showed blockage near the uterus. Since then, I have started IVF and will soon have my transfer, but was wondering if getting my tube unblocked in the future would be something to consider. Thoughts? Could another ectopic happen? Also, your IVF videos have helped me tremendously through this IVF process.
Oh, that's awesome.
Well, thanks. I'm glad it was helpful. It's can be a lonely journey. So sorry about your ectopic. Just you've had quite a road here working on building your family, and I'm sorry for your struggles and grief, and sending you all the baby dust and luck for your transfer. So your tube, left one is gone. Generally speaking, when we think about ectopics, the risk is about 1 to 2%. And
what is an ectopic?
It's when the pregnancy implants somewhere other than in the uterus. Most commonly in the fallopian tube, but can be other places, on an ovary, other places in the abdomen, super rare but possible. Most commonly is the tube. There are different ways to treat an ectopic: medication, surgery, etc. The thing, when you remove an ectopic, when you take the tube, you know that, hey, the ectopic is gone. And you don't have to worry about getting another one in that tube because it's gone.
Gotcha.
Because yes, there is a risk. The thought is kind of, if you have an ectopic in a tube, is there some dysfunction with that tube to begin with? And then if you do medication or where they just try to take the pregnancy out of the tube, is there scar tissue left there or something that is going to lead to another ectopic? So as you said, kind of at the 4-month mark, it sounds like they wanted to do an HSG. So that's, for people that don't know, a hysterosalpingogram or kind of tubal dye test where we inject some contrast through your cervix up into your uterus while we're kind of taking x-ray pictures to see if that contrast spills out your tube. So studies have shown that after an ectopic pregnancy, if you lose a tube, you still, in theory, have another good tube that can go back and forth and etc. You know, to grab an egg from the other ovary, not just the side you ovulate on.
Oh, cool.
So losing a tube for an ectopic pregnancy does not greatly reduce your pregnancy rate by any means. That being said, if they looked and said, oh, hey, tube is blocked, obviously to make a baby, egg needs to be able to meet sperm, and if sperm can't get there through that remaining tube, you're gonna have a hard time. So in terms of when we're thinking about, do we unblock tubes, or is that something to explore? When I hear that a patient has, you know, a blockage very close to the uterus or a proximal blockage, that can be one of two things. One, it's truly blocked, or two, there was a spasm of the fallopian tube when the dye was injected, and so it's not really blocked, but it was just clamped down at the time that you tried to inject the dye through it. All that to say, if you end up needing IVF or doing IVF, we are bypassing your tubes 100%. And so unless, in terms of recommendations for my patients, if your tubes are blocked, but we do not see a dilated tube, meaning that they're, you know, on ultrasound or on HSG, we see that tube is dilated with fluid in it or different things like that, we don't tend to worry about it. Doesn't matter if it's open or not, because we are going to put that little embryo right in the perfect spot in your uterus. Even with IVF, there still is a possibility of ectopic pregnancy. Again, 1-ish% of the time, that little embryo can migrate off to the tube, but very, very rare. So again, sending you baby dust and hoping for your rainbow.
And we've shown some pictures and actually demonstrations of HSGs before too. And so if that's something you're looking for more information about, you can check out this video that we've got a card here for too. Thank you so much, as always, for your questions. We really enjoy this new Sit Down Sunday Q&A.
Yes.
Please try to catch us on Wednesdays for our regular weekly scheduled content as well.
Yep.
And we'll see you guys next time.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.